Well, it's that time of year when many of us start coughing and sniffling, and with RSV surging, along with concerns about COVID-19 and the flu, it can be hard to decipher what's got you feeling under the weather. So before you sit down at the table and give thanks in just about 1 week, you'll need some expert tips for recognizing your symptoms and stopping the spread of germs. That's why Dr. Howard Waksman is joining us this morning. Good morning and welcome, Doctor.
Thanks. Good morning.
Well, we want to make sure that viewers know really what they're coming down with when they start to feel sick. So let's start with RSV symptoms. Can you list some of those for us?
Well, yes, although it's important to recognize that RSV, the flu, and COVID can all present with very similar symptoms. And even though most people will have things like cough, headache, low-grade fever, and nasal or sinus symptoms, not everyone will present with every symptom on the list, and there's enough overlap among some of these common viral respiratory infections that it can be very difficult to tell the differences among them.
And really, let's talk about the flu. So many of us have experienced that before. How might those symptoms be different?
Well, flu tends to have a little bit more of an abrupt onset. So some people will tell you, I was fine in the morning, and then at 4 in the afternoon, I suddenly felt ill. You may be a little bit more likely to have muscle aches and generalized body muscle and joint symptoms. You may get headache and a fairly severe cough at the onset of the illness. But again, the problem is you can get that with many other illnesses. And so on what physicians refer to as clinical grounds, meaning the symptoms with which people present, it's almost impossible to tell the difference among these illnesses unless you do specific testing.
Yeah, and Doctor, I wanted to throw in here, of course, COVID-19, so many people having been impacted by that. And I know there's kind of like a range here, I guess, of what people have been feeling.
Yeah. Obviously, some of the more publicized symptoms like loss of smell and taste are known to be more common in COVID. On the other hand, gastrointestinal symptoms can occur with the flu as well as with COVID. And in fact, in younger children, nausea, vomiting, or diarrhea may actually be seen in the flu as well. And it's more common to see that in the flu when you're younger as opposed to in the adult population. So again, the real problem is the overlap among the symptoms.
Yes, and Dr. Waksman, can people get sick with more than one virus at a time?
Yes, absolutely. And part of the reason for that is simply that the viruses are spread in much the same way, person to person, usually through the air, although sometimes it can be spread through contact with contaminated surfaces if you then touch your face or your eyes and mouth after touching a contaminated surface. But all three viruses can linger on surfaces, although for different lengths of time. And so because of the common way in which they're spread, it also means that the preventive steps that you may take are common. So obviously, the most important thing is to stay home if you're sick and try to avoid contact with other people. But many of the measures that we were taking during the height of the COVID pandemic had helped to reduce the spread of RSV and the flu. And so we're now beginning to see a surge again because we've started to relax many of those precautions. And so all three viruses are beginning to pick up.
Yeah, and with people celebrating the holidays, is there anything else you want them to do? Of course, I'm sure you're going to say some of that good old-fashioned hand washing as well.
Yeah, hand washing. A lot of it, I think, really should operate on the principle of love thy neighbor. If you don't feel well, stay away. And as much as it might be nice to see your aunts and uncles and grandparents and nieces and nephews, the truth is that the best way to avoid the spread is common sense. So hand washing, yes. Cover yourself if you cough or sneeze, although that kind of stuff is imperfect because once it's in the air, it's in the air and it's something you can catch. But really the idea that if you're going to tough it out and you get sick, tough it out away from people who are susceptible, because there's a large number of people in the population who are going to be susceptible and prone to severe illness. Mostly for these three infections, it's the extremes of age. So for RSV, we worry the most about children under 6 months old because they can get more severe illness, which may have consequences even later in life. And in the adult population, anyone who has chronic diseases of the heart or lungs or a compromised immune system is prone to severe disease. So the real way to behave is to just recognize who you might be with, and try to take steps to avoid contact with them at all if you think you might actually be coming down with something.
Dr. Waksman, that is such great advice. Thank you so much for your time, and stay healthy.
Sure. Thank you. You too.